So since 2010, when we started providing services in the care sector, we've used a number of different operating systems. Some have been very complex from large companies who are quite well known in the industry. Others are less well known but have less power behind them. And we moved over to CareLineLive really because we saw that the way that the system functions and the usability of the system was great. It was a simple system to navigate. To train new staff on the system was much simpler than previous systems that we've used. They can be quite convoluted and complex and hard to get the head around, especially when some systems look a little bit like MS-DOS. It can be quite difficult for new staff members to get used to those kind of systems as quickly as we need them to, as you can imagine, with the care sector and the challenges and how busy people can get in the care sector. So we liked the way it looked. We also liked the way that everything is all in one system. So we've used other systems in the past where the app that controls the login and log out system for the care workers in the community is a separate system to the core system, which holds the client profile and care profile information along with the schedules and rotas. But they just speak to each other. But you're having to log into 2 different or 3 different systems to get the information that you need. So we were finding that was quite an inefficient way of working. With CareLineLive, we really liked the way that it was all on one system. There was nothing to download. It's all online, web-based, accessible through laptops, PCs, mobile phones. Really nice and simple to use. The care specialists, as we call them, are really happy with the app. They find it very easy to use. It's encouraged them to make more in-depth notes, and we get more feedback from them because they enjoy using the app. And on top of that, we like the other functions around, barring the core functions of the system. We like the other functions like the capacity tracker that CareLine has, where you can simply put the times and days that a new client inquiry wants to receive services, and the system will suggest the carers that might be available in the best location for that particular client. So that's a really useful tool, especially as our offices get bigger. It can be difficult to hold everything in your head. So to have a system that does that is really good. On top of that, we like the monitoring section of CareLineLive, where you can see on a map where your clients are located, where your care workers are located, and there's a real-time log of who's logged in, who's logged out, who's maybe logged in early or late, or who's logged out late, or maybe somebody hasn't logged out before. So that increases our safeguarding for our care specialists out in the community. Because if somebody's not logged out from a visit in the evening, for example, we can see that in real time and make sure to contact the care specialist and ensure that they're safe and everything's well on their side. So there are a number of benefits to the CareLineLive system that we've really benefited from. The profiles for both the clients and the care workers, very simple to complete. It almost encourages people to complete them because they're quite simple to use and user-friendly. Data collection was an issue for us with other systems in the past because it can be quite difficult for people to find what to put where does this go, where do I put this information. Whereas with the CareLineLive system, we've found that data input has been a lot simpler and easier for staff members to get a hold of, and they've enjoyed using the system. It's not just a system that's there to crunch data, it's actually a system that they've enjoyed putting data into, which is a really important element when you're running a business like this.